The UN General Assembly has approved a declaration calling for urgent action to end AIDS by 2030. They've noted that the COVID-19 pandemic has exacerbated inequalities and pushed access to AIDS medicines and treatments and diagnosis further off. The executive director of UNAIDS, Winnie Binyima, says there may be a resurgence of the AIDS pandemic amid the fallout from the COVID-19 crisis. Well, joining us tonight is UNAIDS Regional Director for East and Southern Africa, Aeneas Chuma, who is the Regional Director here. Mr. Chuma, good evening to you, and thank you so much for your time. Perhaps just, a roundup of how the SADC region, or the region that you cover, has been affected under COVID-19 in as far as the fight against HIV/AIDS is concerned.
Well, thank you very much indeed, and thank you for having us. I think the impact, of COVID has largely been disruptive. You have to understand that by the time the pandemic erupted, as it were, a lot of the countries were in fact behind the targets. Only 19 countries around the world had reached the HIV targets for the year 2020. So the COVID-19 pandemic pushed this back considerably to the extent that services were disrupted and resources were diverted to meet, the challenges of the COVID-19. So the impact of COVID-19 on the global economy, and in particular in the East and Southern Africa region that we cover, has drained resources away from the health sector, including HIV. So it has been largely quite disruptive.
An important question to ask is, before we even get to perhaps advancing the work that is being done in terms of reaching, identifying cases of HIV/AIDS and making sure that those who are positive actually get on treatment. We did have concerns raised about people that had been on treatment but had struggled for multiple reasons to continue that treatment under COVID-19. Do we know today if the majority of people who were on treatment for HIV/AIDS pre-COVID-19 have been able to sustain that period to date?
Well, the evidence is mixed at best. But I think, the basic impact is that COVID-19 has disrupted access to HIV services, and that many health facilities switched their focus to COVID-19. And in terms of people accessing services, I think the evidence is that fewer people went for testing and HIV prevention services, and then some of the people dropped out of treatment, basically by not picking up their medicines because of the lockdowns. In South Africa, we noticed that there were fewer people being diagnosed with HIV infection, and that was a big drop in the number of people starting HIV treatment. And the number of people receiving care for tuberculosis in South Africa, as an example, was 41% lower in 2020 than in 2019. So initially it was disruption, but I have to say that there is a slight improvement because governments and those that provide services came up with ways to ensure that those that needed services continue to receive services, such as multi-month, for example, dispensing of medicine, so that people don't have to go to healthcare services on a monthly basis, as was the case previously.
Mr. Chuma, I can recall about 6 to 8 months ago, just as South Africa was gearing up for its vaccination drive, and there were these very strong suggestions coming through from health activists who were effectively saying that what needs to be done is that the vaccination rollout program and even the awareness campaigns around COVID-19 should also include awareness around HIV/AIDS and tuberculosis. Are we seeing an integration of this? Because if there's a resource shortage, a lot of those resources have gone towards COVID-19.
Well, I think the main lesson from there was that, we cannot deal with one pandemic by diverting resources away from another epidemic, as it were. And that was the point, I think, that was being made by the activists. I think what is important is that HIV needs to be attended to, even as we mobilize additional resources to respond to the COVID-19 pandemic. We cannot treat every disease separately. For example, if you look at TB, which is the leading cause of death for people living with HIV, this means that we must test for HIV among TB patients and also screen for TB among people living with HIV. And so similarly, some approach like that needs to be undertaken when we deal with other diseases going forward.
Mr. Enius Chuma, he is with UNAIDS. Thank you so much for your time tonight.